When she was 6 years old, Regina became ill and no one knew why. It was much later that she was diagnosed with Wilson disease, the copper storage disease. I fell ill as a 6-year-old, shortly after starting school and just before Christmas. Over the next 4 years, there was a lot of diagnosing and a lot of treatment until the right diagnosis was made in 1976. Then the right treatment was initiated. During that time, I was in bed almost 100% of the time until the right diagnosis indicated that that had been total nonsense and had never been indicated.
Und nie indiziert.
Now I think we have really much better ways to analyze children, so it is hopefully wouldn't happen in that extreme way again, but nevertheless still we have these patients that have symptoms but don't get the diagnosis.
The profile of Wilson disease. It occurs in about 1 in 30,000 people. It is hereditary, the cause being a genetic defect. Copper cannot be sufficiently excreted, so it accumulates in the body, especially in the liver and in the central nervous system. It becomes visible in the eyes. So Regina was diagnosed after she had already stayed in bed for 4 years. It was her eye specialist who finally found the right diagnostic pathway.
Mein Augenarzt, zu dem ich eigentlich wegen der Kurzsichtigkeit.
I actually went to my eye specialist because of the nearsightedness. He then said, "I only know this from the literature. I wrote my doctoral thesis on Wilson disease, but I have never seen a real patient. But with your daughter, when I look with the naked eye, without a slit lamp, she has a brownish ring around her eye. That could be a Kaiser-Fleischer ring. At that time, you could see it just by looking at it."
Einfach so vom Angucken sehen.
The Kaiser-Fleischer ring is a circular deposit of copper around the iris of the eye. It may be visible to the naked eye. Often, however, only eye specialists can see it using what is known as a slit lamp. But why did she get this disease? It's because of her genes, or more precisely, her Wilson gene. It is defective, and that is why the protein that is supposed to transport the copper ingested with food into her bile does not work. This is where it is normally excreted, but in her case, the copper has accumulated in her body.
The disease is inherited autosomal recessively. That means that you get it from your parents and that you have inherited it because your parents usually are not ill, but they have one abnormal gene, and then the patient getting ill has unfortunately gotten the 2 abnormal versions. That means that if a patient gets ill, the whole family has to be screened if there are other patients that have really Wilson disease, although they didn't know it.
Many patients who have this genetic defect remain asymptomatic for decades, but sooner or later, most of them develop symptoms. The copper rings, or Kaiser-Fleischer rings in the eyes, are striking. Hepatomegaly may lead to a rather inconspicuous feeling of fullness, and in the further course, signs of developing cirrhosis may occur, such as fatigue, itching, or weight loss. If the course is predominantly neurological, this can lead to tremor, dysarthria, dystonia, gait abnormalities, or drooling.
And even it is possible that you only have psychiatric symptoms like a depression, and that even that might be a Wilson disease. The variety of symptoms is very wide in Wilson disease. You can have only liver symptoms or only neuropsychiatric symptoms. And it's relevant that the doctors think of Wilson disease because some patients only have, let's say, abnormal liver values and another patient only has a tremor. So getting the diagnosis is really tricky, and sometimes it needs really a long time.
In Regina's case, the Kaiser-Fleischer rings in her eyes finally led to the right diagnosis. but she had been without therapy for a long time and she was quite sick. However, if diagnosed on time and treated properly, symptoms do not have to develop at all. So early diagnosis is crucial. The diagnosis of Wilson disease is often a challenge because findings are unclear. Doctors have to combine symptoms, lab results, and genetic analysis. MR imaging of the brain can be helpful when there is presence of neurological symptoms. Sometimes, liver biopsy is indicated to determine the parenchymal copper content, but only in case of doubt, when the genetic analysis does not lead to a clear diagnosis. Nowadays, liver biopsy is usually performed as part of a mini laparoscopy. This way, the doctors can take a look at the surface of the liver and take a probe under visual inspection. Finally, another liver biopsy and a specific copper determination was performed in another hospital by unbiased physicians. And with that, the diagnosis was actually made.
It's very relevant to find the diagnosis and to really make a definitive diagnosis, because with the moment we have the diagnosis, we should start therapy, and we have a very good therapy that works good and makes good improvement. So go for diagnosis and then go for therapy.
There are effective drugs available for the therapy of Wilson disease. What are known as chelating agents are primarily used. These drugs form complexes with copper and thus trap it from the blood. The water-soluble complexes are excreted via the kidneys. Two drugs are available, D-penicillamine and trientine. Another principle to reduce copper in the body is to inhibit copper absorption in the intestine. Zinc salts change the intestinal cells so that they absorb less copper.
It is very relevant to think about what is the best therapy for the patient, because first, with every medication, we really need compliance. So that means the patient should really take his medication lifelong and every day. But the difference between chelators and zinc therapy is that with zinc therapy, you really have to take it 3 times daily, every day, without food. So for young children with not such a regular life, perhaps another therapy is the best than for an older patient having really a regular life.
Another way to reduce copper in the body is to simply take in less copper in food. But a low copper diet is difficult to implement because the element is found in a lot of foods. Even with maximum adherence to dietary rules, it is not enough as a therapy.
A diet alone can for sure not solve the problem. So don't think that you stop with your medication and only avoid copper in the diet. But the diet is really relevant. It means that you really avoid the food with a very high copper content, but it doesn't mean that you really think about everything you eat. But the food with a very high contents you should strictly avoid. The food with a very high copper content are seafoods, chocolate, nuts. These things should strictly be avoided.
Regina has been taking D-penicillamine every day since her diagnosis. She tolerates the drug well, but others do not. An alternative is the newer drug trientine, which has now been approved throughout Europe. But whether health insurance companies pay for it varies from country to country. For a long time, Regina has no longer had any limitations due to the disease. Wilson disease became an issue for me again when I was starting a family, and it was important to me that I could breastfeed my child. The general expert opinion was, no, that's too dangerous. It could endanger the child. But then one of the Wilson specialists said he would support me. I saw him during my pregnancy and while I was breastfeeding, about as often as I saw my gynecologist.
Und in der Stillzeit auch.
Wilson disease is really tricky to diagnose But if you have your diagnosis and take your medication, then you really have an optimal course often and have a normal life. So go for diagnosis, have a good doctor, and then you will have a good life.
Regina lives a good life, and she is committed to helping others with Wilson disease do the same.
Der Morbus Wilson läuft bei mir so mit.
Wilson disease is not only a part of my life, it has also come to spur me on. I'm involved in the Self-Help Association. Counselling people who have not yet reached that stage has become part of it somehow, because the association was also important to me back then. At least from my point of view, you can grow up and grow old with Wilson disease in a normal way, completely unimpaired, just like any other person who does not have a chronic disease.
Ohne chronische Erkrankung auch.